Hello, everyone, and welcome to our First Friday Google Hangout on Advancing Nursing, update on the Campaign for Action. First Fridays are the Robert Wood Johnson Foundation's way of keeping friends of the foundation up to speed on our activities, and we're delighted to welcome so many of you here today. As we will hear today, the Foundation has had a long-standing interest in advancing the cause of nursing in America, and the Campaign for Action has been in recent years the signature initiative to help to achieve that. We have several great panelists on board today to talk about all of this. Let me introduce them to you briefly now. Susan Hassmiller is with us. She's Senior Advisor for Nursing at the Robert Wood Johnson Foundation. Winifred V. Quinn is with us. She's Director of Advocacy and Consumer Affairs at the Center to Champion Nursing in America, which is a joint initiative of AARP and the Robert Wood Johnson Foundation. Alexia Green is also joining us from Texas. She's Professor and Dean Emerita of Texas Tech University Health Science Center, and she's also the former co-lead of the Texas Campaign for Action Coalition. And finally, also with us is Brian Cooper, who's Senior Group Manager for Business Development at the Target Corporation, which, as we'll hear in a moment, also has a great interest in advancing the cause of nursing. We're going to start off with a discussion today among all of us here on the panel. We do encourage all of you, though, listening in or watching today, to tweet us your questions for the panel. Please send them to hashtag RWJF First Fry, that's as in First Friday, so FIRSTFRI. Sue Hassmiller, we're going to start off with you today. Let's start by talking about why the Foundation has had this long-standing interest in nursing, and give us some background on the origins of the Campaign for Action.
Thanks, Susan. It's my pleasure to be here today. The Robert Wood Johnson Foundation's mission is to improve the health and health care for all Americans. We care deeply about improving the quality of care in this country and promoting a culture of health. And in everything I said, improving quality of care, promoting a culture of health, nurses are really key and central to helping us meet that mission. So I loved how you said we are advancing nursing in the country at Robert Wood Johnson Foundation, but I really want to make clear that we are only advancing nursing to meet our mission to improve the health and health care for all Americans. And we have been involved in nursing issues as a way of improving quality of care at the Foundation for a long time, but mostly in the last 10 to 12 years, I would say that we've really upped our ante with our grant making in this area. And after many initiatives, we decided, I should say the board decided, to really up our impact even more. And they wanted a commission on the future of nursing. That's why in 2008, I had the great opportunity to go to the Institute of Medicine to serve as the study director. Donna Shalala was our chair, and produce a study called The Future of Nursing, Leading Change, Advancing Health. And there were so many people, Susan, who were interested in this report as we were in our study process, and especially when it came out. When it came out in November of 2010, it was so popular, so many people were signing on to the webcast that the whole IOM website crashed. But in being successful and having a number of recommendations now that we are trying to meet, my president, Risa Lavisa-Moray, decided that we couldn't let this report sit on a shelf. So we developed what was called, I guess, an implementation project in the beginning to ensure that these recommendations, all 43 of them, really got addressed. And so we developed an implementation process which really turned into this big national campaign. And we have action coalitions, and I know many of our action coalitions are listening today, action coalitions in all 50 states and the District of Columbia, whose job it is to really address these recommendations and get them adopted. I think the last thing I'll say in regard to the campaign, is you'll be hearing from Winifred Quinn. We are in a partnership with AARP because this campaign, the report and the campaign, we always want to say is not about nurses. This is about how nurses can help us meet our goal of improving quality and improving the health and health care for all Americans. And so we might have many nurses, and we do, involved with these action coalitions around the country. But in order to get these recommendations adopted, we have many, many people involved with us. We have policymakers and consumers and educators, people from business. You will hear from Brian. So we have a lot of people involved with us in our attempt to execute and implement this campaign with thousands of people involved with us.
Well, thanks so much, Sue, for connecting those dots for us between nursing and the real culture of health. So, Winifred Quinn, let's go to you. Why does ARP care so much about nursing?
Yes, sure. Thank you so much, Susan. And Sue, excellent segue. So AARP, a 38 million member strong consumer organization, understands that with nurses being the highest amount of the workforce with 3 million strong, that we want Americans to have access to highly skilled nurses when and where we need one. And that's why AARP is so engaged in this campaign. And as a result, we are very focused on ensuring that states and actually some of the federal laws are modernized so that consumers can access all the skills of advanced practice nurses. And that would help all Americans, older adults, and their family caregivers remain healthy and at home and highly engaged in their community.
Great. And we'll come back to you in a moment to talk a little bit more about the center's role in that. I just want to correct what I said earlier. I said the hashtag was First Fry. What I should have said is it is hashtag 1ST Fry as opposed to FIRST. And I believe you also have that on the top right portion of your screens, those of you watching today. So Alexia, you headed formerly the coalition activities in Texas. Tell us about some of the successes you encountered to date and some of the challenges in reaching the goals of the campaign.
Sure. Thank you for having me here today. I'm proud to be representing our Texas team, which is the Action Coalition here in Texas. We have been working diligently, very hard ever since the campaign was launched, and have a very vibrant and active coalition here in Texas. One of the initiatives that I would like to share, which has been most successful and might be of great interest to your viewers today, is our Nurses on Board initiative. We've had great success with it. I think we're one of the first states in the country. I know all of the coalitions are focusing on this, and it's a very important piece of the campaign. But one of the recommendations in the report from the IOM included the need for nurses to be in leading change and to be in leadership positions such as serving on boards. Before this campaign started, very few nurses served on boards, and certainly in Texas, very few nurses served on boards. And the boards we're talking about are hospital boards, policy boards, boards that make decisions that impact patient care and impact focus on the triple aim. So our Nurses on Board initiative, we just launched the first training component of it. We had 26 nurses trained in a pilot just in July, 2 weeks ago, in partnership with a great partner, Texas Healthcare Trustees here in our state, which is a 501c3 partner with our Texas Hospital Association, which provides support for board members who are serving on hospital boards throughout the state. Those 26 nurses that were engaged in this initial pilot that we did had a wonderful experience here in Texas. I think one of the neat things that happened during that experience, they were trained in conjunction with the annual Healthcare Governance Conference held here in Texas, and they were introduced to all of the attendees at the event and have been able to be immediately integrated into that group to create a group of advocates for patient engagement, patient safety, patient quality, and who else could bring better views of all of that to the table than a nurse serving on a board. So the Texas Healthcare Trustees has been a great partner with us. We're looking for other partners. Our initial funding for this has been provided by the Texas Center for Quality and Patient Safety, and we are looking for additional funding to help support this initiative. We plan on phase 1 rolling out. Our goal is to train 400 nurses and that they would be serving on urban and rural communities throughout the state and serving on these boards to bring the voice of the patient, to focus on patient safety and quality to these boards. And I guess then looking at our challenge that we have in our state, you asked me a 2-part question. That part really focuses on our scope of practice and advancing the nurses in gaining a full scope of practice here in the state of Texas and being able to practice to the full extent of their abilities. We have been challenged in Texas for a number of years with this, which has resulted in sort of a convoluted rules that are complex, increase the cost of care, and also create lost time that could be spent with patients by a lot of these policy regulations that require physicians and nurses to spend their time outside of giving patient care. So that's been our real challenge, and we're developing some alternative strategies I'll be glad to talk about later if we have time.
Great. We'll come back to that. Thanks so much. So as we know, 31 states have imposed varying degrees of limits on scope of practice for advanced practice nurses. And that's an issue of concern to Target, Brian Cooper, correct? Tell us a little bit more about why Target cares about all of this.
Thank you, Susan. At Target, we're committed to health and wellness. It's core to our corporate strategy, both as a retailer and as an employer. As an employer, we have over 365,000 team members in the United States. Also, we are an insurer. We're self-insured, which means we run our own plans. So we're a large purchaser of healthcare in the United States. So we care about the health and wellness of our team members and their families. As an operator of healthcare via pharmacies, optical clinics, etc., we also deliver healthcare services in our stores. Target has been committed to the communities we operate and serve in for many years. We do that through schools. We do that through making investments in the communities that we run our stores in. Additionally, as we look at different laws throughout the United States, we look at, as we mentioned earlier, the legislative effort in Texas. We participated with that along with other retailers. So for Target, it's really about what's right for our guests, what's right for our team members, and what's right for the communities that we serve.
So staying on you, Brian, for a moment, what actually have you been doing then in your position at Target to advance this cause?
We participate in the Center to Champion Nursing of America. We are on the board of the Convenient Care Association, which has long looked at laws that might be outdated or not in the best interest of the communities, whether it's in Colorado, other markets, Texas, etc. And we find ways to advocate, whether it's through the Convenient Care Association in partnership with CCNA or in partnership with other retailers and businesses. And in some cases, it transcends the retail industry, and it's just other employers who are frankly large employers and insurers in the market. As an example, in the Twin Cities, a handful of years ago, Target, along with General Mills, Best Buy, and other organizations, really worked with the insurers in the marketplace to ensure that there would be reimbursement for care provided by, as an example, advanced practice registered nurses. Many of the laws in Minnesota weren't necessarily fully conducive to that, but that's not the only issue. The issue is, will the insurers appropriately reimburse for it? And pressuring the insurers to do the right thing. And as a result, Minnesota was one of the early adopters of retail clinics, which, as we all know, are largely staffed by advanced practice registered nurses. So,
Winifred Quinn, to come back to you, scope of practice has obviously been very much on your mind at the center. We know that in recent months and years we've had some successes in some states, broadening scope of practice laws, setbacks in others, for example Nebraska, and some mixed movement in some big states like California. Give us a sense of where things are on this issue nationwide now.
Sure, Susan. So before, you did mention that there are 31 states that still have outdated regulations for nurse practitioners. However, I would say that momentum is on the side of the campaign. I'm very proud to share information that since the campaign began, 6 of the 19 states that have fully modernized their scope of practice laws for nurse practitioners have done so since the campaign began 3.5 years ago. It would have been 7 except for Nebraska. The legislature unanimously did pass a law or a bill this year that would have allowed nurse practitioners full practice authority. However, the governor did veto it at the last minute, and so there was no time for the legislature to reconvene on it. So hopefully we will go back there next year. In California, there was a bill that was very active last summer that would have been in regard to nurse practitioners' full practice authority as well, and it did make it through several committees in the Senate and was active in the House, and then there were so many proposals added to it that it didn't make it valuable to move forward on. So hopefully the very strong set of stakeholders that did organize themselves last year will reconvene next year, and they have Target was involved, several of the retail clinics were involved, insurers were involved, obviously AARP state office was involved. AARP was involved in every single one of those states that have modernized their scope of practice laws. So, and actually in California, physicians are involved. That's so far to date the only state that we are aware of where a physician association has been in favor of the state modernizing their scope of practice policy.
Interesting. So Alexia, you mentioned obviously this is an issue you've had struggled with in Texas, but you've had an alternative strategy you alluded to earlier. What is that?
Well, one of the things we're not necessarily proud about in Texas is that we have one of the largest uninsured populations in the country and some of the poorest health outcomes. So obviously a shortage of providers is also sweeping across the U.S., or at least it's being debated if it's a true shortage. But I believe in Texas we do have a shortage of primary care providers, definitely. And we know that eventually full scope of practice is going to occur in our state. We know that there's a huge need for providers in our state. So we are in the process of working actually with the Texas Association of Business, which is a true advocate for consumers in the state and for the businesses, and developing a strategy to seek additional funding to train additional APRNs in the state. It takes resources to gear up your nursing education programs to educate more APRNs, but the needs there, we're developing a strategy in our state, being led by the Texas Association of Business, to assure that there are enough providers in our state to meet the healthcare needs. And we are behind in this state. We need to move forward, and this strategy is one that can certainly help meet Texans' needs.
So, Sue Hasmiller, how successful do you think the campaign is going to be? And are you going to meet some of the key campaign goals by 2020? One of the key goals, of course, is getting 80% of nurses in America to have at least a baccalaureate level education by 2020. What's the status of that, and are you going to get there?
So I'm glad you asked that question. I'm going to connect the dot a little bit to the conversation we were just having around nurse practitioners, primary care nurse practitioners, and our ability to meet that need. Susan, the vast majority of nurses in this country are educated at the community college level. The IOM committee thought that was fine. It was a way in for many people. In fact, it was a way in for me. I started my own nursing career at a community college. It is where we get a lot of diversity, and diversity is very important to us at the foundation. So it is a way in to nursing. However, if we are to meet the demands of primary care nurse practitioners in this country, if we are to meet the demands for the crushing faculty shortage in this country, the crushing nursing faculty shortage in this country, if we're going to meet the demands to getting more nurses in the community and public health arena where care is moving in this country, if we're to meet all of those demands, we must have our nurses, our community college nurses, continue their education. So a big part of the campaign for all of those reasons is really to move nurses to at least a baccalaureate degree and beyond. We have a goal of getting 80% of our nursing workforce to a baccalaureate and beyond by 2020. And will we get there, you ask? We're working very hard. The states are working very hard on articulation agreements so that, shifting the cultural mindsets of nurses so that every nurse coming into a community college knows, this is my first step, I'm going to move on, and the articulation agreements with the universities have been simplified so that nurses can move on. So we're putting a lot of strategy in place to advance nursing, and we hope we will get there. At the very least, what's very important to us is putting together an infrastructure for the future so that no community college nurse ever has to wonder whether he or she should go on. They know that it's their first step, and it's easy for them to do. Our infrastructure transcends into our getting nurses on boards work. And we want to say that we want every CEO and decision maker in this country to not have to wonder whether they should ever have a nurse on a board or a committee that has to do with delivering patient care. It's just a given. And then finally, with scope of practice, modernizing those laws, setting up the infrastructure so that all payers and healthcare insurers and everybody never has to think about whether they should have a nurse practitioner as part of their panel or whether they should be paid equitably and be a key part of the team. So that's the infrastructure. Will we meet every single recommendation from the IOM report? Probably not. But when we walk away at the end of the day, we want to walk away knowing that that infrastructure was set for the future.
So staying on this goal of 80 by 2020, that is to say 80% of nurses in the country having at least a baccalaureate level education by 2020. Alexia Green, how is this playing out on the state level in Texas? Are you moving in that direction sufficiently quickly, and what, if any, challenges are you encountering?
Well, we are definitely moving in Texas. The challenge issued by the IOM report has been taken up, I would say, with vigor by our nursing education programs in the state. We had probably about a 45 to 46% BSN and above rate when the campaign began. We're nearing closer to 60 now, but we still have a ways to go to get to 80. But there's been some very innovative programs. We have had a lot of work going on by our education component of our Texas team and the leaders. And thanks to Robert Wood Johnson, we received a grant which has been very beneficial in our state to help us build, as Sue was saying, the infrastructure to continue this movement. And we are creating that expectation in our state that a student will enter a community college and then move on to the baccalaureate and higher degrees. And I'm like Sue, I too started with an associate degree. So I think it's such an important piece. We're really working to link in the rural communities. We have a very vast state, so we're using a lot of the technology that's available now to educators to advance this. Very proud of our work. We still have a ways to go, but we're certainly making progress. And I think most importantly is in creating awareness with consumers about the need for the baccalaureate educated nurse as well at their bedside.
Susan, we should mention that the American Association of Colleges of Nursing is following and tracking the number of students we have in programs and those moving on to a baccalaureate degree. And we're very pleased to say that since the report came out, that the percentage of enrollees of nurses going from a community college to a university program has risen 53%.
Great. So clear progress.
I also, oops, sorry, Susan. I also wanted to add to what Alexia said. One of my favorite examples to use in terms of the success of this campaign to date in terms of the 80-20 recommendation is actually in Texas. It's the program that's between the University of Texas at Arlington and a proprietary school, and they have created this very unique program where there's a traditional BSN program, and then there's this very innovative program where students come in multiple times during the year, and they have increased the number of associate degree prepared to BSN prepared nurses by 4,000% over about the last 7 years. It's really quite a remarkable program.
Great. So let's turn to some questions that have already come in from viewers. We've got one that has come in from Ellen Magenheim on Twitter asking, how does scope of practice for nurses vary across countries, that is to say internationally beyond the United States, and are there lessons that the U.S. system can derive to put to use here in the U.S. about how nurses are used abroad? Sue, do you want to start with that?
Interestingly, the Robert Wood Johnson Foundation just this week funded an initiative where we brought in chief nurses from about 15 countries across the globe to talk about that very issue. What can we learn from one another? And Susan, the way that we went into this meeting was, it wasn't so much of what Americans can teach others. It really is what we can all learn from each other. And one of the big lessons we came away with is that the lesson that I talked about at the beginning of this Google Hangout, and it's that we have to keep our eye on the ball of patient care. This has to be about patients and access to care. It can't be about providers and the battles that we sometimes see there. I would say another lesson would be that we all have to sort of work together. Nurses will never meet the demands for access to patient care and these recommendations by working on their own. They need to work with policymakers and consumers. That's why we're so happy that we're working with AARP and our physician colleagues as well. But I can't stress that enough to keep our eye on patient needs, cost, quality, and access. That is what this campaign is about.
Can I chime in on this conversation as well, if you don't mind? I would have to say that I think that's a very important point, and we know that on this video conference today there's all types of individuals. Every one of our states have one of these action coalitions. If you're in one of these states and you're not, your organization, your company, your business, whatever organization you represent is not engaged in your state, find out. You can find out this through Winifred. She can help you to find out, if what your particular state leadership is. Contact those leaders. Ask how you can join this campaign. It's so critical to the future of healthcare in our country, and that's one of the challenges that we have in leading these coalitions in each state, is to engage other stakeholders beyond the healthcare community about the importance of this. This is about your healthcare. This is about the health care that your family is going to be receiving in the future. So we need an engagement all across the country from a variety of consumers.
Well, staying on that point about stakeholder engagement, let me come back to you, Brian Cooper. What themes resonate most in the business community? You mentioned Target is concerned about the cause of nursing from the standpoint of being a payer, a provider itself, an employer. What themes really resonate to help bring more business and corporate activity to bear on advancing this cause?
Well, I think from Target's perspective, as you mentioned, it's clearly, we're a payer as an insurance company, we fund it, and ultimately there can't be a situation where healthcare costs continue to rise faster than top-line sales and revenue. And the amount of money that most of these corporations spend on healthcare ultimately is going to be unsustainable. And these corporations need to have a voice. And when you have employees, and in Target's case we call them team members, as an example, inappropriately using urgent care or ER, and they're going in to an ER because they have a sinus infection and a migraine, when in fact they could have gone to an alternative care delivery site and been seen by a nurse, and frankly just as effectively. That's an inappropriate use of healthcare resources, and that costs the system a lot of money, not to mention the fact that time away from work versus the ability to be seen at an on-site, near-site, or retail clinic. That might be more convenient, and frankly, allowing these individuals to practice to the top of their license is in everybody's interest.
So we have another question that comes in, and it hinges a bit on some of the comments you were making earlier, Alexia. Nurse education in rural communities is a challenge, writes in Denise Thompson. While there are some community colleges that offer courses and some online programs, continuing education courses and on-the-floor training is typically offered at big urban hospitals, not so much available in small community hospitals. So can you speak about any new models that are being adopted to close this educational gap, this experience gap, and even this mentoring gap between what is available in an urban setting versus a rural setting? Alexia, why don't you start with that again?
Sure. I think it is definitely a challenge. I'm not going to negate the challenge that that this question poses, because it is definitely a challenge. Texas, again, has some of the largest rural populations in the country. Our land mass is similar to Alaska, so I'm particularly at a university that serves rural West Texas. But thanks to the technology, such as the technology we're using here today, we can reach out to students all across the country, in these rural areas to continue their education. And it is high-quality education, I might add. I think the real challenge in that question that was posed is more of what can rural hospitals themselves do to improve the quality of care in their institutions. I think two things just right off the top of my head is, number one, engage in this campaign fully. No matter what state you're in, if you're a rural hospital, you should be fully engaged in the campaign and be working to achieve these goals within your own organization, your community, and your state. And secondly, consider the Nurses on Board initiative. Do you have a nurse on your board in your rural community? And if you had a nurse on board, will that voice of the patient be more prominent in those board discussions, and can more be achieved in your rural communities by including these nurses on boards? So good question, tough answers, but important work.
Sue, let me also go ahead.
Add, about the 80-20, 80% of our nursing workforce getting to a baccalaureate degree. There are a number of models, and I would just say that we're using a lot of online technology. Simulation has been very, very important, because I mentioned earlier we have such a faculty shortage. So that's something that's really entering into our thinking, and how do we work with that? So online education, simulation. We also have academic service partnerships. And by that I mean there are some schools of nursing who have faculty in outlying areas, or they will send faculty to outlying areas to train cohorts of nurses in rural areas. So we're doing everything and anything we can to set up this infrastructure, as I call it, for the future.
So we had a question that came in basically pertaining to diversity in the nursing workforce. And of course, Sue, you mentioned this earlier, especially diversity in those who rise to the levels of healthcare leadership. I'm interested in how, potentially, Alexia, you want to weigh in on this, how the program, the training program, is basically also looking specifically at getting ethnically and racially and in other ways diverse populations into these pipelines to assume leadership positions in the U.S. healthcare system.
Well, I think one of the most important things is that you have to be intentional. You have to clearly realize that this is a need within your healthcare organization, within your school. You need to recognize it and then develop strategies, strategic strategies, to make sure that you have a diverse representation within your school or on your board. And if you don't have that intentionality, you're not going to do it. You're not going to achieve it. In our Texas teamwork here in Texas, we've been very intentional about identifying minority leaders and propelling them to engage with us and to assure that we bring them to the table in the discussions and get their ideas also of how to create more diversity in our nursing workforce. And we have some great leaders here in our state that have done wonderful jobs in working on these initiatives. So intentionality, I think, is the key to this piece.
And just to stay on you for a moment, Alexia, could you tell us a little bit more about what is inherent in these training programs that you've been creating in Texas to educate people about serving in these board positions? What do they actually learn in order, and what training do they undergo to be able to serve on boards?
Well, the training is a program that's been developed by our Texas Healthcare Trustees, and it's about governance and the role of the board, hospital governing boards, in transforming healthcare. It very much aligns with the triple aim that we all hear so much about, and this whole
better health care, lower costs,
and improving the patient experience of care. So who else besides nurses know this as well? You know, often or almost always physicians are serving on boards, but nurses aren't recognized as key players to bring that voice of the patient to the table. So preparing nurses to understand the role of governance in transforming healthcare, because a board is very, very important to the quality of care that's received at that particular institution and that community. And to understand their own strengths and align those strengths with the needs that are available through a board service. So we, again, intend to educate 400 nurses in phase 1. We've just completed our pilot. We can't commend enough the Texas Healthcare Trustees. They have the program developed in their training programs that they provide to other trustees across the state, regardless of their background. And then creating this partnership is so important, just as I said before, to move all of these initiatives forward. We need partners like Texas Healthcare Trustees and Texas Association of Business and others.
So a question for Winifred. Winifred, you mentioned that in California there had been at least one physician organization very much in favor of expanding scope of practice for advanced practice nurses. And this questioner, Michelle Greenhalgh, asked, out of curiosity, which physician organization was it that was involved in the California campaign?
Right. So it was the California Physician Group that was specifically in working with the Alliance last summer. And then at the national level, the National Hispanic Medical Association also is in favor of modernizing all scope of practice laws so that to help address reducing healthcare disparities.
Can I speak to something on this as well? I think it needs to be recognized that physicians are engaged in this campaign all across the country. I know here in Texas we have a number of physicians who are engaged with us. They're working to achieve these recommendations in our state. Sometimes it's not necessarily the organized physician groups that are engaged, but there's definitely physician support for this campaign across the nation, and we need to recognize all those physicians who are engaged with us in our work, even in states like Texas.
Yeah, and I would just add that this issue of interprofessional collaboration is very, very important to the Robert Wood Johnson Foundation, so much so that we have sunsetted, or we will be sunsetting some of our leadership development programs, our human capital programs that have been singularly geared towards a single profession, if you will. And we are starting from scratch, building on the great lessons of our uniprofessional leadership development program. We will be coming out with a number of 4 interprofessional collaboration leadership programs, and so everyone should stay tuned for those programs. And just what Alexia spoke to, if people can be educated and trained together from the onset, if they can learn other people's values and what they learn in education, in their education systems, and they get to know each other as people, we think that will transcend to the care that people will get in the long run, and that's what we care about most.
Mm-hmm. So we'll take a final question that came in from a viewer before we wrap up. This is a question that came in from Brandon Rachel. Forgive me if I'm mispronouncing that name, but goes back to a point that you made, Sue, about a terrible shortage of nursing faculty in the country. What is the Robert Wood Johnson Foundation doing to increase nursing faculty? Sue?
We currently have a number of programs. We have our Nurse Faculty Scholars programs, and let me just say this. Yes, we are concerned with the faculty shortage, but we're also concerned with the state of academic leadership. We want nurses, as Alexia so articulately said, we do want nurses to be leaders. We want them to be at the table. So the training and education programs we have at the foundation are really geared towards building nurses leaders in the academic setting. So we have a long ways to go to get a lot of faculty out there. We have a brand new program called the Future of Nursing Scholars program. We have just announced our first cohort, if people want to see the schools that have applied and gotten in. But the purpose of that program is to provide PhD scholarships for nurses all across the country and help them build their leadership skills. So that recommendation, doubling the number of nursing doctorates in the country, we're doing that as well.
I would also like to chime in a little bit there, and that is AARP and a dozen national nursing organizations are also tracking the work that CMS has started, where it's a demonstration program of Medicare paying for graduate nursing education for the first time in its history. So we are tracking that work.
Important work.
Well, as we move to close, I'd love to get the thoughts of all of you about what is most important for the campaign to achieve over the next several years, and what you think are really critical next steps in the various states that have the action coalitions as we all continue to work to put the ball over the goal line, shall we say, by 2020. So, Brian, let me come back to you. From your perspective in the corporate sector, obviously multiple ways in which you care deeply about this issue. What do you think is the most important objective from your standpoint?
From Target's standpoint, what I'd say is what I think this campaign needs to do over time is raise the public voice, tell the story, and raise the dialogue. And I've been participating in the CCNA activities over the last 5 years and impressed with how much progress we've made. Target remains committed to this. But ultimately what we need to do is tell a story so that Joe Public and anybody out on the street understands the value of this beyond a dean of a nursing school or a PhD at the Robert Wood Johnson Foundation. We need to get it out there so that the average consumer, the average American understands. And those are skills that companies like Target understand well. How to really engage consumers, engage the guests, get that story out there. And I think ultimately that's where the campaign will begin to really elevate the dialogue.
Great. So, Alexia, what would you say from your standpoint, having co-led the coalition in Texas? What's the most important next step as far as you're concerned for the coalition to take?
Absolutely. I want to build on what Brian said, the engagement piece. And being a leader of a previous leader of a coalition, and then also working with other coalitions that are struggling to get their coalition formed and moving. It's understanding that coalitions are made up of a diverse array of organizations, and to make sure that the coalition continues to grow and people continue to be aware of this, organizations join, such as Target, businesses across the state, all kind of organizations outside of healthcare that have a stake in this, because we all have a huge stake in it. This is about our future healthcare, about our children's future healthcare. And so creating that awareness and getting other people to join. I hope all of you who are listening, if you're not engaged in this campaign, you'll step up to the plate immediately and find out how to get engaged in the campaign in your state or at the national level.
And Winifred, the same question to you. Critical next steps.
Right. The same question, and I have the same answer, which is the engagement of more diverse stakeholders is very important to the success of this campaign. And I love Brian's idea of moving forward with a very visible engagement with everyday people on this issue.
Telling the story, so important. Right. So Sue, you get the last word on this, as far as you're concerned, from your position really at the helm of this campaign. What's most important to you to accomplish next?
Yeah, well, oh my, before we forget, we have mentioned the website, and I hope people do go to the website, campaignforaction.org, campaignforaction.org, and you can actually go to all the states and click onto your state to get involved at the state level, see what's happening, and contact that action co-lead. I really can't improve on my colleagues and what they said about how important this is for consumers in this country and patients, and we just want to do our role at Robert Wood Johnson Foundation to keep people healthy and build a culture of health, if you will. So whatever we can do to do that, there are a lot of organizations working with us. We certainly need many more organizations. I hope that all of us who are working on this issue of ensuring that people are healthy can keep it at the 60,000-foot level. There are, there can be lots of going backs and forth, and when we're working on all of these issues, but if we can all keep the patient in the center of all of this, patient, families, and communities, I think we'll all be better off in the long run.
And that's the last word. I want to thank everybody who joined us on this Google Hangout today, and especially thank our participants, Sue Hassmiller from the Robert Wood Johnson Foundation, Winifred Quinn from AARP, Brian Cooper from Target, and Alexia Green from Texas Tech University. Thanks to all of you. I hope all of you out there listening today will join us for the next First Friday on Healthcare on September 5th, when we'll be talking about the Foundation's support for keeping kids active and providing healthy foods, snacks, and meals in schools. Again, thanks for joining us, all of you, and have a great day.
Thank you.